Okay, we better, I know it's Friday afternoon and we don't want to drag on too late. So the next session, we've got Moiz, who is one of our senior EPR analysts, who's been doing a lot of work on integration of our EPR, which is epic, with HPO terms and also WGS requesting and things over that. And it's the kind of thing I think you kind of expect an EPR to be able to do almost by default, but actually they don't. And a lot of these things need quite a lot of builds and developments, which is why we've had it for 5 years, and this is stuff we're still working on. So anyway, Moiz has made a lot of progress. So he's going to show where we are with EPR integration, and we'll have an opportunity to talk a bit more broadly about other EPRs and other approaches.
So, hi everyone, I'm Moiz. I'm one of the EPR senior configuration analysts, and I'm here to talk to you about how HPO has been integrated into our electronic patient portal, electronic patient record, Epic. I want to preface this by saying this isn't solely my work. It's a collaboration with all of our EPR analysts, our consultants and clinicians, and also the drive team as well. So before I start showing you all the fancy stuff that we built in Epic, just to give you a bit of a context before we get there. So here at Gosh, our clinicians use a HPO terminology on a day-to-day basis. And unfortunately, there wasn't an easy way to record that into the system. So with our current EPR, Epic, unfortunately, HPO is not currently supported by it. It may be supported in the future, but at this current point, it's not. So there was no simple way to record those HPO terms on a patient level. And this led to our clinicians and our researchers doing a lot of time wasting, having to enter these codes or terms manually in loads of different areas of the system. So when you're looking for that in Epic, you're traversing many different areas. So yeah, not having all HPO terms recorded in one location. So here at Gosh, we try to keep Epic our one source of truth. So we've got multiple systems here within Gosh. Rather than having to get data from multiple systems, we would like to have a reliable system to be saying this is our one source of truth. So none of the HPO terms were recorded in there. And due to not having any HPO terms recorded in a structured format in Epic, we couldn't really run any reports or anything for research purposes. So what did we do? So the drive team, a lot of the clinicians came up to us and asked us for a very, very long time to get HPO into Epic. And through many, many conversations, we did eventually arrive at a solution. So one was to build a simple way to select HPO terms on a patient level. So regardless of if you're seeing a patient as an outpatient, inpatient, or wherever they may be on their journey, we want to be able to see those terms no matter what. Similar to your problem list, so where you're seeing all of those diagnoses and things listed up there. Similarly, we wanted those terms to be recorded to be easily viewable and make those terms into discrete data so they can be pulled into your clinical notes, letters, and reporting for reporting purposes. So what did we do? So we took those 17,000 plus HPO terms, and I'm not going to bore you with all the details of what we did, but we downloaded it through a JSON file. And what we did is we broke it down and looked for the two main factors, the two data points, which was the ID of the HPO term and the label of the HPO term. So we took those away and we integrate that into Epic using something called a smart data. What that essentially means is that one element equals to one HPO term. Now, this is very basic. We can't delve further into what that HPO term would show apart from just the general label. So you can see on the right-hand side, these are some screenshots from Epic, where we've started to record some of those terms on patient level. These terms were then all filed into one database, which enables us to use specific filters to filter around those HPO terms. We then created a specific space in Epic and solely for recording those HPO terms. So that screenshot at the top is specifically for HPO terminology. It may develop further genomic data as well. At the moment, you can jump to that activity to just record those terms. And using that same filter, when you interact with it, you can break it down and add more terms into it for that for a patient level. And you can also amend it and update it, and it will also have those HPO IDs, which is something very important for our clinicians here because they're going to go away and do further research using those terms. Moving forward, we said one of the problems was we wanted this to be viewable from any point of view in Epic. So something in Epic that we have is something called chart review. So no matter where the patient is on their journey, whenever you load a patient's record into, whenever you launch a patient's record in Epic, you're greeted by something called chart review. Chart review is generally like a little snapshot of what conditions or what problems the patient might have and the history that they may have. And we really wanted it to be prominent there up front that you've got your HPO terms listed there. I don't know if you can see that in the little red boxes there. Easily, we've got the name of the term with the IDs as well. And we made it very simple and easy to jump straight into that activity to update any of those terminologies. So we were talking earlier about the fact that none of this data is discrete data. And so therefore we can't really do anything in terms of research. But now that it is discrete data, we built something called a slice and dice model. Now what that is that you can take little parts of that HPO terms reported across all of our patients in Epic, and you can start building reports out of it. So this is like a little quick shot that I did in one of our test systems. And just said, grab me the top 20 HPO terms recorded on our patient here at Gosh, and it just displays. So we've got this many patients with, it's really tiny to see, but not probably as a result of that one at the top. You can break it down, you can go further, deeper into it, see what patients have it, and then from there you'll be able to do further research. So the exciting part now is that now that we've got that into the system, we can now integrate this into other areas. So a key feature or key workflow that we use here a lot at Gosh is whole genome sequencing. So this is essentially requesting WGS on multiple patients. And one of the requirements for requesting this testing is having that HPO data recorded. On the picture on the bottom left is our new workflow that we've built. So this is essentially an order request for WGS. And we've now been able to build those HPO terms directly into the left-hand side. So that at a glance, you'll be able to see whatever HPO terms are recorded in our patient. And because it's discrete data, it also then, on the right-hand side, you'll be able to see it pulls into our reports as well. This gives us a very good way to see how we can do this moving forward, or we can do moving forward. We can then pull that data into our clinical notes, into our letters, and potentially any other areas in Epic as well. I know I went very fast and I went very quick, but I just wanted to give you a little snapshot of what we're doing in Epic, and I'm happy to take any questions that you have.
It's worth saying that building this kind of stuff, it's the kind of stuff that it should be quite easy to put new categories or sets of data terms into a system like Epic, but it's incredibly difficult, and then getting it to display and then be used, be accessible for the right purposes, like slice dice. And so just for those of you that are not used to using Epic, so slice dice is a tool that allows you to start off, say, with a cohort patient, whether it's all patients or all patients of a certain age or all patients with a certain characteristic. And then you, as it says, slice and dice, you could say, right, now pull out all the patients who had an abnormal full blood count or who have got some other parameter. It all has to, it can only use data that is structured in Epic, and that's always an issue that we don't have enough structured data. But of the data that's structured, most of that you can use to slice and dice and pull out cohorts. And now that we've got the HPO terms, we can obviously you know, in that slicing and dicing to pull out cohorts with particular HPO terms or combinations of HPO terms. So that should be really useful for identifying patient cohorts and researching audits and all of those things. So I think many of the additions here, this feels like a real kind of step forward. Yeah, we'll have to see how it evolves over time. Absolutely. I don't know. Sorry, a few questions. I think you were first.
Sorry, yeah, just really quickly. I don't use Epic in my day-to-day work, but just for information to part of my influence, are these HPO terms in phenotypes or is it separate? Or how is it integrated into phenotypes?
So they're not integrated across both platforms. So Phenotype uses its own data, and Epic we've custom built those HPO terms into them. So they're not cross-referencing.
So the clinician or whoever might enter HPO terms into Epic, and then another set of HPO terms would need to be entered separately into phenotypes. Is that correct?
Yes, so as I was saying, like what we ideally want to do is have Epic to be the one source of truth. I just will explain a bit.
Thank you. Probably
Sorry.
comment on that.
Yeah, unfortunately at the moment, duplicating data. So essentially when we order whole genome sequencing, we have to data references into Epic. For generating differential diagnosis, etc. These phenotypes.
Okay.
So sorry, just to say, as part of the project, we originally, so I'm from the Drive the Innovation Team at Industry. So we originally talked about doing integration where HPO would be entered natively into phenotypes, which was mentioned earlier, which for anyone who isn't aware, perhaps online, it's a specialised tool which can be used for various genetic tasks or to build phenotypes as well. So HPO entry, family tree drawing, entering genes, identifying genes of interest, and perhaps decision support. But anyway, we had originally thought about having the point of entry for HPO phenotypes and putting that into Epic. That didn't actually prove possible and also went against the principle that Moiz is talking about. So I think the next step would potentially be actually to reverse our original plan and look at integration from Epic into phenotypes. At the moment, though, what Gosh wants to do is make sure that we build a really healthy data set of HPO terms. And the best way to do that, given that only a tiny minority of people actually use phenotypes, is to have it natively in Epic. So that's the rationale, effectively. I'd really like to say thank you to Moiz and a colleague of his, Flavio, for the work they've done. It's been a very long time that we've been trying to do that, with support from Robert, Ajit, Micah, and also from the laboratory team in our EPR team. One of the other things, which isn't particularly relevant today, but it's important to talking about, is we've also got a link now to our genetic laboratory system, which is separate to Epic, which means that any variants that are identified as reportable by our clinical scientists will start to be feeding into the back of Epic as well. So in the years to come, Great Industry will hopefully have a very rich, both clinical and laboratory structured data set that will allow clinicians to be able to slice and dice themselves, build cohorts of patients, and really power research. So I think this is really important.
I was thinking that in the morning, I think someone said about integrating like SNOMED with HPO, because how we were trained when Epic went live, I was actually one of the trainers, so we trained others, is that it was like problem driven, like how we were doing things in Epic, like the problem is a sort of almost key, and then the assessment plan sort of sits per problem. I don't think people are doing it per se this way now, but that was sort of the essence, like the problem is everything sort of should be surrounded by that. So are we, because I haven't thought about that, because there's a couple of things. Peter said in the morning that almost every month they are updating HPO. As immunologists, we know on the European level they're going to update all the trees for like all the immunology sort of backgrounds. What is it like a low T cell, what's leukemia, all these things. So are we also going to update this with regular sort of like real time with with Peter basically, and also can we in the future integrate it with the Robinus?
That integration question, maybe we can just park it for a second, because I was hoping to bring that up as part of panel discussion, because I think this question about the different classification systems and how we integrate, but also update. So we'll come back to that. Question.
Yes.
Yeah. Go, pass it, why don't you pass it out? Over here.
Hi, yeah, great that despite these challenges, you managed to have a go with the trying implementation solution. It's real time significant. I would say it's still worth to keep on talking with the APR providers like Epic to try to integrate the HPO terms natively within the HR systems. I want to ask you instead, so you mentioned you use that now for WTS, so yes, it could be both for rare disease and cancer if needed.
Yes.
Yes, and is there any reason why we could not kind of link it to our tests if needed, so for example, selection sequencing and other types?
So now that functionality is there, definitely, there is a lot of potential that we can do. We're still working on a few little things with the WGS side, but providing that all works well, I don't see why we can't integrate that in other requests.
Hi. Is there any thought being given to integrating patient-reported symptoms? Just bringing the point here that patients often don't disclose things, but that can be very important. And then they have their own Epic interface. Has there been any thoughts of a way of linking that perhaps in future?
That's definitely something that we'll note down. At the moment, it was quite a challenge just to get this part in right now. But as we evolve and as we go forward, I think that's definitely something we can consider.
Certainly, there are ways of collecting patient data from the patients using questionnaires through the portal and things. So we are collecting that data, but not integrating in a structured way at the moment in the same as HPO terms. But obviously, we would love to be able to collect structured data from the patients themselves, because often that's the best place to collect it.
Hi, Ms. Talk. I was wondering, when you imported the HPO terms into Epic, are you directly pulling from the HPO itself? Like, for example, the HPO gets updated, as Peter mentioned, about once a month. So I'm just curious if you're capturing, this term labels changed, term definitions change, and so are you capturing those changes, or did you sort of just do to start like a one-time harvest everything and then just put it in there as it's?
So it's a great question. Because the amount of time it took just to even integrate into Epic, even in that time, the data set was updating and evolving. So as we were doing that, we realized we would need to have a regular cycle to update these terms. So what we've done is we've made it coincide with our regular Epic upgrades that we've got, and revisit the data set at that point to then update everything that we have in the system. So that would include label changes, any discontinued terms, or new values as well. Thank you.
So it was worth incorporating into this system some quality of life outcomes more than patient-reported actual severity. Sometimes there is over-reporting. We see that very commonly happening in our neurology patients. I'm sure other specialties have the same problem. There are multiple implications of that, like the quality of life, because if you want to embed one of the questionnaires into your clinical tool, you will need a special license, and this is costly as well. But this would be definitely worth, I believe, adding on, because this is a very good cost effectiveness measure for our treatment. It is very relevant to the patient, and it's very very badly studied, I would say.
So we do have some standardized questionnaires built into it already, and I talk about which ones we have.
Quite a few.
SDQ, I think.
SDQ,
SQL, yes. So a lot of people don't know actually those are available in Epic that you can send to patients.
Kind of patients who really
Yeah.
and they're now available for just
Yes.
Some are built into Epic already and the licensing sorted out. Others aren't because of perhaps licensing questions or just haven't been built yet, but they are there, some of them.
How can we find out which are these tools that are available? Are they reported anywhere? Yeah, you can search it within Epic. Whenever you load up a patient's chart, maybe I can show you afterwards. You can find it all available questionnaires there. And I'm sure I can probably grab a list from the BBR team as well.
Thank you. There's a few questions on mine. So is that allowed under the licensing? I presume that's relating to having the HPO terms in Epic, which it is all right based on the discussions between, I guess, it's all been worked out anyway.
Yeah.
It's all been done.
Yeah.
Legally. No, the sharing of the recording.
Oh.
So you talk about the recording of this discussion?
Yeah, of the session.
Of the session. Oh, okay. So all the speakers have signed sharing agreement. I don't know if that's what you're referring to, the speakers.
So Robert, could Sarah contact me outside the meeting?
Yeah. Sarah, contact Paul Goff to look into that in detail. Phenotype data is stored on phenotypes. Have you thought about how you can pull through from phenotypes into the order? So that's what we're talking about. You know, initially we were looking at the ability to pull data from phenotypes into Epic. That is incredibly difficult. Putting any data into Epic from any other system is not impossible, but I think very, very difficult. So now that's why we moved towards the solution of putting the HPO term directly in Epic and then thinking about is there a way we could pull that into phenotypes. But these things are technically very challenging. Quickly, the HPO terms should be viewable in alphabetical order in Epic for ease of finding them.
We've currently got them via ID, so it starts from 1 all the way down. So we've got it in numerical value. I guess that's something that you want to.
But you do a smart search, don't you?
Yes, you can still do smart search. You can do partial searching as well. You can even search by the ID and pull up the.
I mean, we may well, as we go along, think about the ways of presenting the terms, and I think it's something we should kind of evolve as people use it. Being what's a joint conversation, unfortunately, I don't think we can join by voice, unfortunately, so I have to stick with using the chat, unfortunately. Okay. That's Cambridge University Hospital, right? So meeting between Adam Brooks and us, yes.
So
we can.
Jerome sent Sarah my email address, so that's fine.
Okay, great. Another question, Mark?
Sorry, just a really quick practical question. I'm Julie Doctor, who's currently doing some research at Gosh. And you mentioned the slice-and-dice tool. How is that best accessed?
Probably the easiest way is just chart searching for slice-and-dice. So if you just search in the tool of slice-and-dice, it usually comes.
So it's everyone who's got access.
Yeah,
That's easy.
Should be on your normal screen in a little one of the bottom right hand of the screen. You just have to look in the right space, find it. Oh yeah.
So one of the things I found in terms of coding for rare diseases on Epic is not great. So that's why we use Gittics to code rare diseases. So the slice dice is restricted by that.
Right. General question: what is the correlation between HPO terms and ICD codes? To what extent are they comparable to ICD codes incorporated? I think this ties in again with the question about different classification systems. So maybe should we just kind of move seamlessly into panel bit of this, because I think there are quite some of these like bigger questions that we can maybe address as part of that. It's just a comment about customer slicing. So I know on the agenda we've got these two panel sessions. We might merge them into one because I think there's quite a lot of overlap. But the plan was to have kind of the speakers and we're going to include Daniel as well. Just to maybe address some of these slightly other broader questions. So let's move to that. Shall we have the panel at the front?